My name is Mark Haber. I'm a shoulder surgeon. The people who require shoulder surgery or indeed develop shoulder problems tend to be three groups. They're the younger teenagers often who injure themselves at sport. They tend to be boys more than girls. Then there's the middle age, and they tend to be the tradies who've spent their lives working above shoulder height. We as humans have been designed to climb. We've got massive climbing muscles to climb up. But what we haven't been designed to do is the opposite, is to hold things above our head. And unfortunately, that's what a lot of tradies have to do. And then there's the elderly. They tend to be more women than men, and often they're 70s and 80s. Okay. Computer-navigated shoulder replacements are probably the greatest advance in shoulder replacement surgery in my working life. Utilising computer navigation, we're able to achieve enormous precision, certainly within 1 degree of alignment and 1 millimetre. So when we do shoulder replacements, we liken it to achieving a wheel alignment in your car. If the tyre is not perfectly aligned, it wears out prematurely. If it remains perfect, you get much better longevity of your tyres. And the same applies when we do shoulder replacement surgery. By far the most common shoulder procedure we perform is rotator cuff repair surgery. Unfortunately, as you grow older, these rotator cuff tendons wear out. And the best way to assess this is with an ultrasound. Rotator cuff repair surgery is now entirely arthroscopic. So through keyhole incisions, we were able to visualise and stitch up the torn tendon. There are two types of shoulder replacement, what we call the anatomic or classical replacement and the reverse replacement. The classic replacement is when we replace the ball of the shoulder joint with an artificial ball and the socket with a socket. A reverse replacement is when we actually replace the ball with a socket and replace the socket with a ball. The advantage of a reverse replacement is the anatomical classic ball and socket replacement requires the rotator cuff tendons to hold everything in position. Unfortunately, as you get older, the tendons wear out and a shoulder replacement would therefore fail. By reversing the situation and making the ball the socket and vice versa, it acts a bit like the tow bar of your car, provides enormous shoulder stability, and therefore you're not so reliant on the rotator cuff tendons, which unfortunately do wear out. Once your shoulder pain is starting to become severe and interferes with your sleep at night, we need to do something about it. So, if you have shoulder pain, don't ignore it. It's a bit of a case of a stitch in time saves 9, so you should see your GP early.